But first, well, another legal challenge to the right of private health care to compete in the public system began today in Vancouver. Orthopedic surgeon Brian Day is taking on BC's Ministry of Health in the BC Supreme Court. He's arguing for privately provided and paid for medically necessary treatments. Well, to discuss the future of private and public health care as either adversarial or complementary, we are joined by the Federal Health Minister, Jane Philpott. Welcome to the program, Minister Philpott.
Thank you.
Where's the federal government on this debate? I mean, is there room for the private delivery of essential health care in your view?
Well, as you know, there is already some health care that's delivered privately in this country, but in terms of the medically necessary care that's protected under the Canada Health Act, we are absolutely firm in upholding that act. As you know, we're a government that makes sure that we support the growth of a strong middle class, and the strong middle class is based on making sure that health care is there for people when they need it, on the basis of that need, not on the basis of the ability to pay.
Okay, but sometimes that's not available when people need it, and I'm wondering at what point in time is health care delayed, health care denied, and people should be allowed the option of going a private route?
Well, we have an excellent healthcare system across this country where high quality care is delivered, and it's important to make sure that that high quality care is available to people when they need it. And anything that will provide a barrier to accessing that care or will mean that people who have extra money get to the front of the line faster than others is not a fair system. And to continue to have a fair and just society where people will be able to know that that care is for them, we absolutely need to uphold the principles of the Canada Health Act.
Should the Canada Health Act, though, say that if a province can't deliver a medically necessary treatment in a reasonable amount of time, that they're forced to pay for that procedure being done somewhere else? I know that's a slightly different debate, but still.
It's a different debate, and in this case, as I say, while some people may feel that they would like to be able to pay, the problem is for that system, as soon as we decide that somebody is able to get to the head of the line because they're able to pay privately, we're functioning in a healthcare system that does have limitations on its resources, that there is a limited number of hospitals and doctors and nurses, and to be able to make sure that care is for medically necessary procedures and services is distributed in a fair way. It's important that that care goes to the people that need it and that it's there for Canadians when they need it, and not on the basis of who's able to pay more.
So if Dr. Day wins, what's the consequence for BC? I mean, does this end up in the Supreme Court here?
Well, you know, I don't want to comment on the specifics of this case, and as you've already pointed out, this is actually a case that's with the British Columbia legislation that it's dealing with. We sought intervener status as a federal government because we believe that the results of this case have implications across the country, and we wanted to make sure that those who were involved in arguing the case were aware of our concerns about the outcomes of this case. We certainly look forward to making sure that Canadians will always be able to have access to the care that they need. That's a fundamental priority of our government.
But isn't it possible that if you could allow people to purchase private medically necessary procedures, it would take strain off the public system? In other words, I mean, doctors might presumably come in from other countries to provide it. I mean, is that not an argument that's valid? It's
an argument that people have been put forward, but in fact that's never been borne to be true. This has been studied repetitively over decades. We've looked at other systems in other countries that have instituted barriers to access to care, and there is evidence that when those barriers to access go up, when somebody is able to get care because they can pay and another person has to wait longer, then unfortunately it ultimately causes a detriment to the entire system. So what may benefit that one person who has access to care is actually not helpful for the entire population, and we have a responsibility to make sure all Canadians have access to care.
But Quebec or some other provinces can buy private insurance. I guess it doesn't quite go to the medically necessary level, but is a patchwork going to develop in Canada if Dr. Day wins in BC?
Well, as I said, there are already some kinds of services that are not covered under the Canada Health Act where private services are delivered, but we believe that the care that's delivered by doctors, that's delivered in hospitals, needs to be there for Canadians, that there would be very serious concerns in terms of the outcomes. As soon as those barriers to access are there, it means that people will use less care. they will use sometimes less care of things that might be perceived as not essential, but they will also use less care of the things that they really need. All of that preventative care that if people have to pay an extra fee to be able to get, that they might not do, and ultimately the entire system suffers.
You don't see any need to tweak the Canada Health Act at all? You think it's written in the way it should stay forever and ever?
You know, the Canada Health Act, as I say, we firmly believe in. It has a number of really important principles, including, of course, accessibility, universality, public administration, etc. Not everything is covered in there that could be covered, but at this point, the important thing to do is to make sure that we uphold the Act as it is, that we make sure Canadians continue to be able to get the care they need.
You got a little hot water over the summer over the use of a ministerial limo agency with Liberal connections. I mean, you're a rookie minister. Did you learn anything from that experience?
There are always lessons learned every week in this particular job that I'm in. In that case, we learned that my office paid more than they should have for some of my travel expenses on a couple of important meetings that I had to go to over the summer. I've indicated already that I'm paying that back, and we will be setting a very high bar and making sure that that will not happen again.
Learning on the job. Okay, Minister, thank you for coming in. Appreciate it.